Thank you, Nick.
Thank you very much, Nick, for chairing that excellent debate. It was very interesting because you actually touched on quite a few topic areas where AWF has funded research and where it is about to fund research. We've just put out a call for research to address the topic of breeding for better welfare. And as you know, AWF covers all the species. So we'll be looking at that to see where we can make a difference in that. But now we're going to turn back to a topic area we funded before, which is around timely euthanasia. Earlier today, you heard the report of work looking at factors involved in timely euthanasia of dairy cattle and calves. And now we're going to hear from Carol Gray at the University of Liverpool, who worked on an evaluation of delayed euthanasia in cats and dogs using electronic health records. We'll hear the recorded delivery now from Carol, and then she's going to join us for questions afterwards. So please put your questions online for us. Thank you.
Hello, everyone, and welcome to my presentation on a study I carried out to look at delayed euthanasia in small animal veterinary practice using analysis of text from clinical records or electronic health records. My name is Carol Gray. I'm a veterinary surgeon, and at the time of this research, I was a postdoctoral researcher in the School of Law and Social Justice at the University of Liverpool. My research questions are listed here. First of all, I wanted to look at how delayed euthanasia, which I categorized as where euthanasia was discussed in a consultation but not actually carried out during that consultation, how this was evidenced in the electronic health records. I also wanted to look at what vets used to reduce the welfare impact of delayed euthanasia. And my third question was, what is the effect on welfare of delayed euthanasia? As we'll find out, I managed to answer the first two questions, but the third one was a bit more problematic. Data for this study were obtained from SAVSnet, which is the Small Animal Veterinary Surveillance Network, and it's hosted at the University of Liverpool. The network collects near real-time consultation data from around 500 veterinary practices in the UK. Each consult includes animal signalment data, as well as the clinical free text written by the veterinary surgeon at the time. Each animal patient has a unique ID. The protocol developed to identify relevant consultations for the study used regular expressions, a form of text mining, to identify those involving euthanasia. 500,000 consultations from 2018 were explored, and the search returned 14,000 records. A random sample of 1,000 cat and 1,000 dog consultations were read in detail to exclude those consultations where euthanasia was carried out at the time, leaving examples of delayed euthanasia. And as you can see, we analysed 76 cat and 69 dog consultations in detail. Themes were developed using inductive analysis, where codes remain close to the original data, and were analysed at a semantic level, which means accepting the written text as the intended meaning. In the next few slides, I provided a few illustrative quotes for each theme. I've expanded any abbreviations used, but the text is as it was originally written. The first theme was advocating for the animal patient. This consisted of one party, either vet or client, broaching the subject of euthanasia. The other party could then disagree. The top two examples illustrate bringing up the subject, while the next two show disagreement with that suggestion. We examine reasons for disagreement in our paper on this research, which is currently in press. Specific strategies used to delay euthanasia included buying extra time, for example, by wishing to involve others in the decision. And in the examples shown, it seemed that the vet involved was comfortable with delaying that decision. There were, however, some consultations where the vet seemed to be pushing for a speedier decision, as in the second example here. But in most cases of delayed euthanasia, the animal patient was provided with palliative treatment. Most often this consisted of pain relief, although other drugs were used to control nausea, to improve breathing or circulation, or to stimulate appetite. When it comes to calculating the welfare impact, I tried to estimate this by multiplying the severity of the illness involved using a modification of the generic illness severity index by the number of days between euthanasia first being suggested and then being carried out, and subtracted the mitigating effects of palliative treatment. But I ran into two problems. First, there were only a small number of cases with follow-up consultations available. Now, this may have been that they went to out-of-hours providers or different practices for their follow-up consultations, or it could be that something went wrong with the database. And second, using the severity index, illnesses were given a score up to a maximum of 16 because there were 4 parameters with scores from 0 to 4, while palliative treatments were given an arbitrary value of 1. So we always ended up with a positive welfare impact. To address this, each treatment would be better given an individual score depending on its efficacy, but that would need a panel of experts to decide on this. In summary, the use of electronic health records to analyse euthanasia discussions was effective, even though they only give one side of the story. These consultations are difficult to access directly because they are sensitive and emotionally charged. Electronic health records give an impression of the negotiations that take place around euthanasia, although it was noted that there was no evidence of the use of end-of-life care plans, which are recommended by specialist organisations in the animal hospice movement. And as discussed, we need to do some more work on calculating the welfare impact of delayed euthanasia. Future work could include reanalysis of the data to look at how end-of-life conversations proceed when euthanasia is carried out at the time of first broaching the subject. And we could also look at equine end-of-life conversations using similar methodology, as the equine database is currently being developed. We could also look at how this area of practice is taught in vet schools. Finally, thank you for listening. I'd like to specifically thank the Animal Welfare Foundation for funding this research. And thanks to my colleagues from SAVSNet, Professor Alan Radford, who acted as data chaperone, and Dr. PJ Noble for providing the random samples from the original data set. And finally, I've listed my references used. Thank you very much for listening.
Thank you, Carol. That was an excellent summary, and that raises quite a few thoughts in my mind, and we've got questions coming in on Slido as well. I was particularly struck by your comment about out-of-hours practices, and I thought about the flow of data and information that's needed to make sure that that sort of feedback loop of information occurs. coupled with your comment around end-of-life care plans. Do you have any other further comments on that? Because for me, that seems to be a way forward that we should explore.
Yeah, of course, the out of hours practices is quite an interesting subject, because I'm not sure that they were always part of the SAVSNet collaboration. So it could be that animals were lost to follow up if they went to out of hours practices that weren't part of that scheme. We're very dependent on the practices that participate in SAVSNet. The end-of-life care plans, well, this is broaching the subject of palliative care and hospice care for animals, which is a very, very hotly debated topic at the moment. It's very big in America, and it's the American Animal Hospitals Association that has produced these end-of-life care plans with the Animal Hospice Association. So it's sort of, do we open that can of worms in the UK? Are we actually interested in palliative care and end-of-life care for animals the same way that it's done in America, where it is sad to say quite big business, I think. So yeah,
Okay.
that's a big can of worms, I think.
Well, we've got two questions that sort of follow on from that are quite linked, Carol. One from Catherine Ellis. People are reluctant to discuss end-of-life plans for themselves, let alone animals. How can we encourage discussion on end-of-life decision-making? And then there's a second question from Deirdre Carson. It is often a surprise for an owner to learn that their vet is going to recommend euthanasia. And how can we balance the animal's needs with those of the client? So perhaps you can explore that again, because I think this issue of delayed euthanasia sort of is the result of some of this aspect of the communications and the decision making.
Yeah, and certainly, I agree with Karen that euthanasia is a perfectly feasible treatment option for many cases. But also that communication is the big thing. And I would say that, wouldn't I? Because communication is one of my passions. But I think the earlier we can talk with clients about shared decision making around, the animal's trajectory and when we might need to be starting to talk about end of life, I think the sooner we can start that conversation with our clients, then the more involved they can be in making that decision. And certainly the thing that really struck me about the consultations I looked at was the number of times that vets actually put clients off having euthanasia performed. Because I was really surprised at that. I thought it would always be the client that was delaying euthanasia, but there were a surprising number of vets saying, no, I don't want to euthanize this animal today. And that was
interesting.
a surprise, yeah.
Yeah, that is interesting. There's another question here from Catherine Owen. Was there any evidence that vets introduce owners to quality of life questionnaires?
I didn't find any evidence of the use. I know there are quite a few that have been validated, and there was no evidence of them being used in any of the consultations. Of course, going back to my caveat, we're just getting what the vet wrote in the clinical record. So it could be that there was a discussion about quality of life measures that didn't get recorded in the clinical record.
So did you pick up any types of metrics that were being used to assess quality of life or welfare? There's a lot of talk about the animal welfare assessment grid tool, which has obviously come out of research, but were you seeing any practical measures that vets in practice were taking to try and do something like that was practice friendly?
Well, as I say, there was nothing that seemed to be based on any evidence, but the common things that were recorded were that they were going to give the animal a chance until it stopped eating, or perhaps was no longer able to move. They seemed to be the two main features that were discussed. The ability to move around and also the ability to eat.
Yeah, good. So we've actually got a very practical question here from Julian. What should we be encouraging to record routinely on clinical notes to aid further decision making? So this is a practical question. What are your top 5 asks?
Gosh, that's another research project in itself. But I think as far as, making it easy for the next vet that sees the client, if you've discussed euthanasia and not performed it, is to see what measures you were using to help the client to realize when the decision needs to be made. And I think that would help enormously. And perhaps, if it was just a delayed decision to allow, say, other members of the family to say goodbye, that was clearly written in the record. It was quite often written, but sometimes it wasn't actually specifically written down.
Mm-hmm. So did you feel there were limitations of the electronic records, or do you think electronic records per se are sufficient to capture this kind of softer side of decision making?
I think it was an interesting project because I wasn't sure whether it would actually glean any useful data. And I think I sort of managed to find out the way the decision is approached from both the vet and the client. But yeah, a lot of the time I was very frustrated just thinking, I wish I'd been in the room. I wish I'd been listening to this conversation. And I think that is the best way to capture it, really.
Yes.
Well, record it.
Well, thank you very much, Carol, for looking at this topic area, because it is a very important area to try and get some data so that we can analyse what's going on and help move this forward. So thank you very much. It was a great piece of work. I'm now going to pass on to Chris, who has the nice task of telling us it's nearly lunchtime. Chris.
Thank you, Fiona. It is indeed lunchtime, but I think before we go for lunch, I think we should just have a virtual round of applause for everything that's happened this morning. We've had some fantastic presentations, some really fantastic comments from the audience, and it's been wonderful to see so much interaction, because I think my concern about doing this virtually was that we wouldn't get the level of interaction. Clearly we are. So well done everybody for this morning, and thank you. Don't forget that you can still use the platform to interact with other people. You can go to the student project and to chat to other people in the chat rooms all the way through lunchtime. But please be back for 2:10 when we will start this afternoon's session, and we'll move on to COVID and other similar matters. Thank you very much for listening.